How is air quality ensured in a plastic surgery operating room? Imagine stepping into a space where every breath you take is carefully controlled to keep you safe during surgery. That's exactly what happens in a plastic surgery operating room. Maintaining excellent air quality is essential to prevent infections and ensure a smooth recovery. Hospitals and clinics use a combination of advanced systems to keep the air clean and sterile. One of the main tools is high-efficiency air filters called HEPA filters. These filters can trap at least 99.995% of tiny particles like bacteria and viruses. This is especially important during procedures involving implants or delicate tissue work, where even small contaminants could cause problems. These filters are part of the ventilation system that constantly cleans the air inside the operating room. Another key feature is laminar airflow systems. These systems provide a steady, unidirectional flow of sterile air directly over the surgical site and instruments. Instead of air swirling around randomly, laminar airflow creates a clean curtain that reduces bacterial contamination by up to 95%. This helps keep the environment as sterile as possible during the procedure. The operating room is also maintained at a slightly higher air pressure than surrounding areas. This positive pressure pushes air outward, preventing any contaminated air from entering the sterile space. It's like a protective bubble that keeps germs out. Air exchange rates are carefully controlled too. Standards recommend at least 20 air changes per hour, with some of that outdoor air coming in to dilute any airborne particles. This constant refreshment of air helps remove any bacteria or dust that might be present. Temperature and humidity are also monitored closely. Keeping the room between 68 and 75 degrees Fahrenheit, ideally below 72, helps control warm air rising from the patient and equipment. Proper airflow velocity, usually around 35 feet per minute directed downward, helps counteract thermal plumes that could carry contaminants into the surgical site. Surgical smoke produced by tools like electrocautery can contain harmful particles and chemicals. To prevent this from polluting the air, smoke evacuators are used near the surgical area. These devices capture smoke before it can spread, protecting both staff and patients. Finally, environmental monitoring plays a vital role. Regular checks of particle counts and air quality ensure that filtration and ventilation systems are working effectively. The goal is to reduce airborne particles by at least 90% compared to outside air, confirming the environment remains safe. All these measures work together to create a sterile, safe environment for plastic surgery. Advanced filtration, controlled airflow, environmental controls, and pollution management are essential to reduce infection risks and promote healing. If you're considering a procedure, always trust that these safety protocols are in place to protect your health. Remember, it's always best to consult with qualified medical professionals for personalized advice and to understand how your specific procedure will be managed safely.